The New England Heart and Vascular Institute of Catholic Medical Center would like to thank you for choosing us as your healthcare providers. We have produced this video to provide you information regarding your recent heart attack. We will discuss what a heart attack is, what treatments are available to you, and what measures you need to take in the future to manage your cardiac health. You will be given a packet of information by your nurse with written material to supplement this video. Let's start with a brief overview of the structure and function of the heart and what happens when a heart attack occurs. The heart is a hollow, muscular organ which beats approximately 100,000 times per day, pumping blood throughout the body. Blood will flow through the heart from the right side to the lungs, where the unoxygenated blood receives fresh oxygen, then to the left side, where it is pumped out of the entire body. Coronary artery disease is the atherosclerotic process that develops in the coronary arteries and can begin in childhood. A small fatty streak starts in the wall of the artery. Over time, the streak accumulates fatty buildup within the wall of the vessel and causes a narrowing. The narrowing, or blockage, causes a decrease in blood flow to the area of the heart muscle below the blockage, and symptoms can occur. The most common symptom that people experience are chest discomfort, shortness of breath, fatigue. Other symptoms can be nausea, vomiting, dizziness or fainting, indigestion, and sweating. Cardiac symptoms can occur anywhere from the bottom of your nose to the diaphragm. Some people experience some or all of these symptoms. Some people do not have any symptoms at all but have their heart disease discovered through a routine physical exam or testing. The symptoms of heart disease can be vague and subtle and can mimic other physiologic problems. It is common for many people to ignore the symptoms or attribute them to something other than their heart. Sometimes the symptoms are caused by a temporary loss of blood flow caused by an artery spasm. This is called ischemia. The discomfort that is felt with ischemia is called angina and can be treated with nitroglycerin. Since the blood flow is restored to the heart muscle in a short period of time, no permanent damage is done to the heart. If the heart muscle is deprived of blood flow for a prolonged period of time and is not responding to nitroglycerin, a heart attack may be occurring. The severity of the heart attack depends on the length of time the heart muscle is deprived of the blood flow. The most common way that a heart attack occurs is when the cap, or covering over a blockage, breaks and a clot is formed. This blocks the artery further, leading to a complete loss of blood flow to the heart muscle. If the blood flow is not reestablished quickly, the heart muscle is permanently damaged. A rapid heart rate, anemia, valve disease, lung disease, or any situation that puts unusual stress or strain on the heart can contribute to the muscle damage. Regardless of the cause, if the heart experiences a loss of blood flow for a prolonged period of time, the damage is permanent. A heart attack has occurred. The extent of damage from a heart attack can vary from mild to severe. When the damage is mild and does not show up on an EKG, it is called a non-ST segment elevation MI, or non-STEMI. This damage usually does not go through the full thickness of your heart muscle, and the pumping action of the heart is preserved. If the damage is extended through the full thickness of the heart muscle, it usually shows up on an EKG and is called an ST segment elevation MI, or STEMI. Depending on the extent of this type of MI, the pumping action of the heart could be affected. If MI treatment is initiated promptly within a few hours of the onset of symptoms, it is possible to reestablish blood flow to the heart and limit the damage from a heart attack. If you are experiencing a heart attack, there are many tests that may be performed to measure your cardiac status. Some common tests are troponin level, which is a blood test that measures the presence of recent cardiac damage. An EKG measures the electrical activity of your heart and can help determine if damage is occurring. A stress test can be done a few days after a heart attack to assess the function of your heart muscle and determine the extent of damage. An MRI can do a similar thing. An echocardiogram will take an ultrasound image of your heart to see how well it is pumping and how well your heart valves are functioning. One measurement of the heart's pumping action, which is calculated during an echocardiogram, is called ejection fraction, or EF. EF measures the volume of blood that is pumped out to the left side of your heart with each heartbeat. An EF of 60 to 65% is considered normal. A cardiac catheterization looks at the blood flow through the coronary arteries by injecting dye or contrast and observing the flow through the arteries, looking for any narrowing caused by blockages. During a cardiac catheterization, your cardiologist may perform a percutaneous intervention, such as an angioplasty or stent, if it is feasible, and this will reestablish blood flow to the heart muscle. The development of fatty plaques found in coronary artery disease is influenced by certain risk factors. These are in two categories. First is non-modifiable risk factors. These are things about yourself that you cannot change, such as age, gender, and family history. Men over the age of 45 and women over 55 are more at risk of developing heart disease. A family history of heart disease puts you at more risk, especially if your family member had a cardiac event before the age of 55. Since you cannot change these risk factors, you will need to focus on the modifiable risk factors, which can help control and slow down the process of cardiac disease. Smoking raises your heart rate and blood pressure, increases blood sugar, affects cholesterol levels, and allows multiple toxins to enter your bloodstream, including carbon monoxide. All of this can contribute to the development of heart disease. The ideal blood pressure is 120/80. If your blood pressure is 140/90 or above, the pressure that is exerted on the blood vessel walls can cause damage to the lining of the arteries and contribute to fatty plaque formation, as well as causing strokes, kidney failure, and other health problems. Cholesterol is needed to make cell walls and hormones in our bodies. Our liver manufactures cholesterol. Sometimes it overproduces cholesterol. Sometimes we take in too much cholesterol in our food. There are two main types of cholesterol: the LDL, or bad cholesterol, and the HDL, which is considered the good cholesterol. The LDL cholesterol is the main component of fatty plaques. Once you have a documented cardiac problem, you need to keep tighter control over your cholesterol levels. Ideally, we want your total cholesterol to be less than 150, your HDL to be greater than 45 if you're a man and 50 if you're a woman, and an LDL cholesterol less than 70. Diabetes causes excessive sugar levels in the blood. This produces degenerative changes in your blood vessels that promote the development of fatty plaques, as well as increasing the risk of high blood pressure, strokes, and other vascular disease. Obesity, or being overweight, contribute to heart disease, especially if you carry the excess weight around your waist. Excess weight also contributes to the development of high blood pressure and diabetes. Stress will initiate a complex system of neurologic and biochemical changes in your body. Hormones like adrenaline and cortisol are released, and these can damage your heart, constricting blood vessels, affecting fat metabolism, increasing salt retention, raising blood pressure and heart rate, and promoting plaque formation. Eradicating stress in your life is not realistic. However, you can learn to successfully manage stress. Physical inactivity contributes to the development of many previous risk factors, including high blood pressure, high cholesterol, diabetes, and weight gain. Moderate exercise has positive effects on all the cardiac risk factors and strengthens your heart, as well as promoting the development of collateral or extra circulation. In order to manage your risk factors and slow the progression of cardiac disease, your recovery and treatment plan will include modifications to your diet and to medications and activity levels. Once the heart muscle is damaged in a myocardial infarction, the heart muscle surrounding the area of damage does not function properly. It takes time for this muscle to heal, which is why you are usually observed in the hospital for 24 to 72 hours before you're allowed to go home. You will need to continue to rest the heart muscle at home, so your physician may actually prescribe some activity restrictions for a period of time that can range from 1 to 6 weeks. Even though many patients feel well soon after their heart attack, if you increase your activity too quickly, you can delay the healing process. Until you start cardiac rehabilitation, we ask that you keep your heart rate less than 20 beats above your resting heart rate. For example, if your pulse rate while sitting and resting is 70 beats per minute, we do not want your pulse to go above 90 beats per minute with activity. Ask your provider when you can return to work or resume other specific activities. In addition to temporary activity restrictions, you will also need to modify your diet, and a dietitian will speak to you about these modifications and give you some written instructions to help you. In addition to these things, you will also be placed on some important medications after your heart attack. There are several categories that are important for you to learn about and continue. Antiplatelets, such as aspirin, help prevent the platelets from being sticky and causing clots. This will be taken daily for the rest of your life, unless there is some reason you should not do that. If you've had a heart attack, you are usually prescribed Plavix or Brilinta, which needs to be taken for approximately 1 year. These help prevent clot from forming within a fresh stent. It is essential that you take this medication as directed and do not discontinue this without speaking with your cardiologist. Another medication that is often prescribed after a heart attack is called a statin medication, such as Lipitor or Crestor. These medications not only lower your cholesterol, but they stabilize plaque and inflammation to help prevent further cardiac events. You will also be prescribed nitroglycerin. Nitroglycerin dilates your coronary arteries and the arteries throughout the body to help resupply the heart muscle with blood and oxygen and reduce the workload of the heart. It is used to help manage chest discomfort from angina. If you experience any symptoms of angina, such as chest discomfort, pressure, squeezing, shortness of breath, pain or numbness radiating down your arm, into your shoulders or jaw, it is important that you stop activity immediately, that you sit down and rest. You take a nitroglycerin and put it under your tongue and let it dissolve. If after 5 minutes your symptoms have not resolved, you should take a second nitroglycerin. If after an additional 5 minutes you are still having symptoms, you may take a third dose of nitroglycerin, but you should also contact 911 and be transported to the hospital via ambulance. Chest discomfort that is not relieved by 3-nitroglycerin can be indicative of a heart attack. You will need to be evaluated to prevent further damage to your heart from occurring. Nitroglycerin can also cause some common side effects, such as dizziness. It is important that you sit while you take it. If you feel profound dizziness that does not go away, then do not take nitroglycerin, but call 911 and proceed to the hospital via ambulance. Another side effect can be a severe headache, which are common. But as these are not life-threatening, we ask that you continue to take your nitroglycerin until the symptoms are resolved in your chest, and then you treat the headache afterwards. Nitroglycerin will also lose its potency after a period of time and does need to be stored properly. It should be kept in a cool, dry place away from light, heat, and moisture. It is recommended that you keep it by your bedside while you're at home, and do not put it in the bathroom or the refrigerator. There's too much moisture in these areas. Once you open a bottle of nitroglycerin, it is only good for about 6 months. It would be helpful to write an expiration date on the bottle and also place it on your home calendar so that you remember to replace the nitroglycerin after it is expired. You want to make sure that it will work for you when you need it. It is important to keep nitroglycerin with you wherever you go. Coronary artery disease is a chronic disease process, and at some time in the future you may need it to help control symptoms and prevent further damage to your heart. Do not let your prescription expire, and make sure you keep it fresh and with you at all times. If you smoke, it is imperative that you stop. Smoking is one of the most preventable causes of heart disease. It may help you to know that the symptoms of nicotine withdrawal will subside around 2 weeks after you stop smoking. Building on this time that you've spent in the hospital can start you on the road to recovery. While it may be difficult, there are many different therapies to help you with tobacco cessation. Please speak with your provider to discuss what option would be best for you. With all the changes that you may need to make in your lifestyle, it is common to experience a variety of emotions. These emotions can include denial, anger, depression, anxiety, and fatigue. Do not be surprised if you experience mood swings in your recovery period. Allow yourself the time to learn about your disease process and adjust to this new perspective regarding your health. If you need further assistance, please do not hesitate to discuss this with your healthcare provider. Once your heart muscle begins to heal, it is strongly recommended you attend a cardiac rehabilitation program. Cardiac rehab is a special exercise and education program tailored to cardiac patients to help promote their full recovery. It provides outpatient physical conditioning with risk factor modification and education to promote your cardiac health and your recovery. A team of healthcare providers, nurses, dietitians, and exercise physiologists work with you to establish heart-healthy routines. Your cardiologist will supply a referral to a cardiac rehabilitation program that is closest to your home. Please schedule an appointment with them as soon as you are cleared by your cardiologist. Once you are home, we would like you to call your healthcare provider if you have any symptoms of chest discomfort, shortness of breath, excessive fatigue, nausea, vomiting, and sweating, or an irregular heartbeat. Of course, you can always call if you have questions about your medications or treatment plan. We hope that this video has been helpful to you and will find you on the road to recovery from your heart attack.